All right, today we're diving into one of the most incredible pieces of engineering in the entire natural world, the four valves of your heart. I mean, these things are the unsung heroes of our bodies, working nonstop from our very first heartbeat to our very last. So let's see how they pull it off.
So just stop and think about that number for a second. 2,000 gallons every single day. That's kind of like filling up a small swimming pool. Your heart is this amazing pump, right? But what good is a pump if everything can just flow back the way it came? It wouldn't work. So how does it create this perfect one-way superhighway for your blood?
Well, the answer is these four little gates. They are the entire reason blood flows in one direction, and only one direction, making sure every single part of your body gets the oxygen it's screaming for. And you know what the craziest part is? They don't have little motors. They work passively. They're just pushed open and pulled closed by pressure changes. It's just an unbelievably efficient design.
Okay, to really understand this, we're going to follow a single drop of blood on its journey. Let's start on the right side of the heart. This is where the blood comes back after its long trip around the body. It's low on oxygen, and it's basically showing up to get refueled.
So our first stop, our first checkpoint is the tricuspid valve. It's the gatekeeper between the right atrium, that's the receiving room, and the right ventricle, which is the pumping chamber. And the name tricuspid pretty much tells you what you need to know. It's got three little flaps, or cusps, that fit together perfectly to make a seal.
Now here's the really cool part. How do those flaps stay shut when the ventricle squeezes with all that force? Well, the secret is these tough little cables called chordae tendineae. We call them heartstrings. They act just like the ropes on a parachute, anchoring the flaps so they don't get blown backward into the atrium when the pressure builds. It's brilliant.
So, this tricuspid valve belongs to one of two big valve families, the atrioventricular valves, or AV valves for short. They're the ones with the heartstrings, and they separate the upper atria from the lower ventricles. The other family, which we're about to meet, are the semilunar valves. Think of those as the big exit doors from the heart.
And here we go, our first semilunar valve. Once the blood is loaded into the right ventricle, it's got to get to the lungs. The pulmonary valve is that one-way exit door. It also has three cusps, but notice the big difference: no heartstrings. It doesn't need them. Its clever half-moon shape is all it takes to snap shut and prevent backflow.
Okay, our little drop of blood just took a trip to the lungs. It's gassed up, it's bright red with oxygen, and it is ready to rock. We are now on the left side of the heart. This is the power station. This side is a high-pressure system that has to be strong enough to pump blood everywhere, from the top of your head to the tips of your toes. And the left side has its own two specialized valves. First up is the mitral valve. It's an AV valve just like the tricuspid, but it's special. It only has two cusps. That's why it's also called the bicuspid valve. Then you have the final boss, the aortic valve. This thing is the heavy-duty security gate that has to handle the highest pressures in your whole body as blood blasts out into the aorta.
And check this out, this is probably one of the coolest design features in the whole body. Right behind the flaps of the aortic valve are these little pockets, and that's where the coronary arteries, the arteries that feed the heart muscle itself, begin. So the very first thing the heart does with all that fresh oxygenated blood is pay itself. It's that whole put your own oxygen mask on first idea built right into our biology. So smart.
Now, these valves are unbelievably tough, but they're not invincible. And when they start to fail, things can get pretty serious. So let's take a quick look at what happens when these perfect little gates start to have problems.
The two most common issues are actually pretty easy to get your head around. First, you have stenosis. That's when the gate gets stuck. It's stiff or narrowed, so the heart has to work way harder to squeeze blood through that tiny opening. Then you have regurgitation. That's when the gate is leaky. It doesn't shut all the way, so blood flows backward, making the heart a lot less efficient.
So you have these major conditions: stenosis, regurgitation, prolapse, and infections. And the bottom line is, if even one of these four gates isn't working right, the whole system can get thrown into chaos. It just shows you how absolutely vital their perfect, coordinated dance is. Every single beat of your heart is counting on them.
Whew. Okay, that was a whirlwind tour, right? 4 chambers, 4 valves, so let's lock it all in. We're going to put it all together in a quick recap that will make this whole journey stick in your head for good. This table right here is the ultimate cheat sheet. You can see each valve, where it is, what it does, and see if you can spot the pattern. The 2 AV valves, tricuspid and mitral, they open during diastole. That's when the ventricles are relaxing and filling up. The 2 semilunar valves, pulmonary and aortic, they open during systole.
That's the big squeeze, when the ventricles contract to push blood out. It's just this perfect, beautiful rhythm.
And hey, if you ever need an easy way to remember the order of the valves, just remember this silly little phrase. Try pulling my aorta. T for tricuspid, P for pulmonary, M for mitral, and A for aortic. It's the exact path we just took on our journey.
So I want to leave you with this one last thought. Over an average lifetime, each of these valves will open and close more than 2.5 billion times. Billion with a B, usually without a single mistake. That's just a staggering feat of natural engineering. It really makes you wonder, right? What other incredible, mind-blowing marvels are hiding inside of us right now?